I'm looking for Dr. Gibalechian.
Hey, you came to the right place. What you coming in for?
My lower back has been bothering me from
Alright.
sports.
We could set you up today. If you could fill this out for us, and we
Okay.
can get you started, and we'll get the doctor.
Okay.
Hi there, I'm Dr. Gibalechian, and you are?
Hi, Alyssa.
Nice to meet you. So, tell me why you're here today.
I've been playing a lot of field hockey lately, and my lower back has been killing me.
You've came to the right place. Have you ever heard of chiropractic or been to a chiropractor before?
First time.
Really? Okay, so we'll set you up. If you could fill this out, it's going to give you a case history. It's going to give you your pain from 1 to 10, and anything else that has to do with your issue today, and then we'll assess that once you finish, okay?
Okay.
Great. Are you done?
I am.
Great. So I got a few questions to ask you, if that's okay.
Mm-hmm.
So the first one is, what's the major reason why you came to the office today?
For my lower back pain, specifically on my right side.
Your right side? Okay, great. Well, little did you know that we have a lot of patients who come to our office for that. So I'm going to tell you a few things what we're going to start with, and then we'll finish it off.
Okay.
So first, we're going to determine how we can help you and if we can help you. And first we need to do a comprehensive case history. So like if you have any issues with your family or past history on yourself. And then we're going to do a physical exam to assess what's going on and find an issue. And then we're going to do a chiropractic exam, which you might have never done before. So we're going to do some x-rays because that helps us find a diagnosis and pinpoint what the issue is. So once these exams are done, I'm going to put together what I found for a final review. Does that sound okay?
Great.
So have you ever gotten an adjustment or been adjusted before? So basically, what you're coming in for is an issue with the spinal cord or the nervous system, and once it's interfered with, we're going to have to give you an adjustment, which is a specific force and technique that needs to be given in order to free that spinal cord of all the interferences. Does that sound good?
Mm-hmm.
Perfect, so that's what we're going to do. Okay, great. So if you can follow me, and then we'll get you started.
Okay.
All set?
Mm-hmm.
Great. So I'm going to ask you a few questions about your pain again, if that's okay.
Okay.
So on a scale of 1 to 10, 10 being the worst, 1 being the best, what's your pain level?
8.
8. So that seems a little high. So hopefully we could try to get that lower with a few techniques. So how do you make it better? Like, what are some things that you do to make the pain better?
I lay on the ground with my feet up, and I ice my back.
Okay, those are really good home remedies to do. Anything that makes it worse?
Sitting for a long period of time.
Okay, so we're trying not to let you sit a lot today, and we're going to try to do some motions. Hopefully they don't exacerbate it.
Mm-hmm.
So I'm going to ask you to face forward,
Okay.
and I'm going to do sitting down. I'm going to do a couple of examinations. First is visual. So I'm going to examine your back, and that will allow me to see if there's any lesions, scars, any inflammation, redness, or high musculature, and that will give me a differential diagnosis so I can be able to see what the core issue is, okay? So I'm
Okay.
going to open your gown. Is that okay?
Sure.
Okay. And now I'm just going to visually palpate and observe. So I'm going to see if there's any high musculature. Okay, I found something on the right-hand side. And you said previously that was on the right, correct?
Mm-hmm.
Okay, so I see some edema and I see some redness. So maybe that's the area. So I'm going to further do some movements, and hopefully if anything hurts you, let me know so I will stop immediately, okay?
Okay.
All right, so first thing I'm going to ask you to do is sit up straight. The next thing, if you can cross your arms like this, okay, I'm going to reach around you. Is that okay? Great. So I'm just going to bend you forward and back, okay? Forward and back, okay, forward and back. That seems normal. Next one I'm going to do is rotate you, and then I'm going to bend you towards me. Is that okay?
Mm-hmm.
Okay, I'm going to rotate you. Ooh, you seem a little restricted. How does that feel? Does it hurt?
Tight.
It's
Very
tight, right? Okay, so I'm going to also bend you towards me and see if you can bend, okay? You seem to be able to bend, so I think the rotation, so we're not going to do so many movements. Maybe it's from the issue with the sports, so we'll try to get that honed in. So the next thing we're going to do is some x-rays.
Okay.
And once we get x-rays, I could be able to visually show you what the issue is, because I don't know if you've ever seen an x-ray. And then we could start diagnosing and then hopefully start a treatment plan. Is that okay?
Sounds good.
Okay. So for the x-ray, I'm going to stand on the side of you so we can get a good view. So
Okay.
stay right there, and we're going to do some shots. Okay, now turn around. This is called lateral view. Next shot. And then just turn facing that way. Perfect. Okay, now let's see our views. All right, so we have the X right here, and it's taken on a posterior view. So right here we have the spinous processes, and on either side are TPs, which are transverse processes, if you can see here. And then what we have here is a scoliosis on the right-hand side, which might give you a little bit of pain, but the main problem here is the L4. It has an open wedge, and it's pinching the nerves, so it's probably causing all of your pain, and an adjustment will be able to fix that. Okay, so you could lay here, face down, please. So what I'm going to do is an adjustment. I'm going to contact your back. Is that okay?
Mm-hmm.
Okay. All right, now please stand up and let me know how you feel. Is the movement okay?
I feel like I have better range of motion.
Okay, let me do another one just to make sure. On your back, please.
On my back?
Yep.
Okay.
I'm going to do your cervicals because that's where the main cause is.
Okay.
All right. All right, now stand up, please. And just walk a little bit up and down.
This is kind of,
All right, perfect. And how does that feel?
much better.
Much better? Okay, so what I did was an adjustment, and usually the main issue comes from the cervicals, which is your atlas, and then everything just comes back down, but I also focus on your L4, which was the cause of your problem. And after that, once I gave you an adjustment, all the subluxations were clear, and now we can start a diagnosis. All right, Ms. Salviti, how did that adjustment feel?
Great.
Great, so I wrote out a plan for you, if you could look here. So the first thing I want to do with you is do some home remedies like you've been doing, like you've been laying on your back and putting some cold compresses, if that helps. And next, I want you to come in twice a week, if that's okay, allowing your insurance. Do you have insurance by any chance?
Yes.
Perfect, so that will cover you completely, and you can come in twice a week depending on your schedule. You can schedule at the front desk, and we'll do that, and we'll do the same adjustments depending on the severity, and if it gets better, we'll check it and re-examine it and see if it's doing well, okay?
Okay.
So you can take this home with you, and if you have any questions, please give us a call, and I'll see you next week.
Okay.
Perfect.
Thank you, doctor.
Over a few things that I want to discuss. The first thing is what kind of patients come in and where do they come from. So the first type is internal patients, which is a referral or someone who's already in the office and bring patients in. The second one is external, where we find patients in different activities such as local health care screenings at malls. So these procedures have different type of categories. Category 1 is an internal procedural event where we do a healthcare class at our clinic, and we're able to bring in referrals so we can build our practice management. And we always emphasize this on the 10th visit of a current patient. This 10th visit gives us a high quality patients because people already know the people are coming in, so they'll be very viable. The second type is internal special event. We usually have these 4 times a year, and this could focus on the patient, and we usually do a screening, like a spinal screening, at the local mall or any area near us. The third type of category for a patient is an external procedural, where we go to a mall and do multiple spinal screenings, which brings some type of patients in, but not that many. And the fourth is a healthcare booth at a huge event. And this doesn't bring us the most, but it's still a reliable source. So on the 10th visit, we give a feedback pamphlet, and at the end there's a referral section. So this is where we pretty much build our practice. We're gonna ask what would it take for the patient to bring in a referral, and if they can understand the chiropractic principles that we understand. That basis allows the patient to bring in the referral and help them, guide them through the chiropractic care plan and help them understand it. So what the benefits of this is, it allows other patients to realize that they're not the only ones doing this. There's so many people who are doing this. So they have a good foundation and reliability. So we're going to ask them what is the best option for the referral, and that option they can take with them and bring them in for the basis of a good foundation for chiropractic. So now what I'm going to do is discuss two binders. First is the research binder, and next is our patient binder. For the research binder, the first tab we're going to have is vertebral subluxation, and this is going to have all my documentary and all my articles for my future basis for good practice management. So the first one we're going to have subluxation. It's at a Dagmar Science. It pretty much talks about the subluxation complex and like different types of research topics that allow us to emphasize and grasp the concept. The next one is wellness development care. Pretty much it helps us assess the best practice document that the chiropractic care office has. And we also assess health promotion, disease prevention, and wellness. So this is a good article for that. The next one is subluxation condition-based care. This one we have an example of an atlas vertebral realignment. So what this does is allow us to assess the cervical spine, and it gives us good research, so I can refer back to this just in case I'm a little iffy on whether to adjust that specific type of atlas listing. Then we have chiropractic spinal. This is a mechanism of chiropractic spinal adjustment and manipulation. So it pretty much talks about the spine and how it can relate to chiropractic and all the adjustments that the patient can take and to what extremity and extent that they can take it. The next one is functional neurology and chiropractic. This is a really good article because it talks about how neurology and the nervous system correlates with the spine and how subluxation is the main cause of neural impingements. So these are great articles for me to read because they can relate to the patient and we can explain to them and refer back to this and give them a good understanding. Other articles under the current mechanism system is just some new articles that have been printed that give us a good understanding of what's like actually going on. And there's bad medicine, which is traditional medicine, where we try to compare chiropractic to traditional medicine and tell them what the differences are and also the benefits of both, because we don't want them to rely on one and not be open to the other. And we have new vitalistic systems. And I have an article here that says that we can use interpretations of healthcare researches and attributes. So we have a bunch here. And then for the next one, this is where my patient document is. So the first one is the pre-visit, where I tell them to fill out the form. And when they fill out this form, they give me all the information of why they're here, their pain level. This is an empty one just to show you where the pain is, and on a scale of 1 to 10, that really helps them, give them a sense of how much like they need this chiropractic adjustment. The next one is the first visit. So I have here a simulated one where they've written all of what I just told you, and then on a face-to-face basis we discuss it and elaborate it so they can get a better understanding of what is actually going on in their bodies. Then a progressive exam is after I do the first few adjustments, I give them a care plan, which allows them to see and visualize what is going on and what I want them to do for the next few times. Healthcare class is very important. I usually give this out before patients come in. And what I do is, for the healthcare class, I give them kind of like a seminar, and I explain to them what chiropractic is, the benefits, how it helps their full like vitality, and it can improve their lives, and it's something that they really need in their lives. So I strongly recommend it to them. I have a report of findings, which is all the listings that I find as a chiropractor. They might not understand it, so I have to break it down to them for them to understand it better. But all the listings I find, I write in this area under these boxes: cervical, thoracic, lumbar, or maybe pelvis. And then I do assessment, like what the function is, what makes it worse, same, or better. I also write a care plan, I write all my findings and I make sure it's specific enough, because if I don't, then I could be sued for malpractice insurance and that will not be good.